What is diabetes insipidus? Generally speaking, the disease is related to people's pituitary gland within the brain. When we hear the term diabetes, we immediately think of diabetes mellitus, commonly referred to as sugar diabetes. However, diabetes insipidus is not triggered by the absence of insulin. It is triggered when the pituitary gland cannot produce sufficient amounts of the ADH, antidiuretic, hormone. 4 types of diabetes insipidus. This hormone is essential because it controls the level of water within people's bodies. Diabetes insipidus can often be a serious, if not fatal condition, if the patient is not treated immediately, or if the illness is not caught on time. In serious cases, the treatment might last for the rest of the patient's life. Still, in much more fortunate situations the condition can be cured, as long as the patient abides by a strict treatment. Diabetes insipidus is a condition that comes in 4 types, central diabetes insipidus, lipogenic diabetes insipidus, nephrogenic diabetes insipidus, gestational diabetes insipidus. Unfortunately, no one knows for sure what triggers diabetes insipidus. Nevertheless, there are clear elements that trigger it. To begin with, a brain aneurysm, also known as a weak spot within a blood vessel that causes the artery to blow out, could cause a bulge. Ultimately, that bulge might lead to diabetes insipidus. Some other conditions could be any sort of brain infections, a tumor within the brain, or within the pituitary gland, excessive, compulsive fluid intake, bleeding within the skull, diabetes insipidus genes, usually happening in men. It's important to remember that the disease has nothing to do with sugar diabetes. A simple head injury that can harm the pituitary gland might lead to diabetes insipidus. Consequently, kidney disease and even pituitary gland surgery can also lead to the above-mentioned condition. Patients are advised to consult with a physician as soon as they come across the following signs: dry skin, particularly dry hands, too much urine, constipation, excessive thirst for cold drinks. The diabetes insipidus treatment usually depends on what triggers the problem. For the first time, the naturopathic community agrees with the allopathic medical community. In order to treat the disease, it's critical to find the cause first. This statement is a groundbreaker for most naturopathic treatments, while the allopathic branch is much more focused on the practice of the treatment. The following treatments and tests might greatly help individuals deal with their diabetes insipidus. To begin with, it's important to undergo a full medical history exam. The doctor will collect urine and basic blood tests to determine the condition's seriousness. Afterwards, a CT scan, computerized tomography, will be required in order to establish the exact cause of the diabetes insipidus. Daily weights are required to determine gain or fluid loss. The patient will also go through a dehydration test. An MRI, magnetic resonance imaging, will also be required. Finally, if the condition is serious enough and a tumor shows up, the patient will have to go through a surgery that will remove it.